Umetishia mkutano kujadili mbinu mpya. Umeitisha mkutano wa kujadili mbinu mpya za kufadhili huduma za afya, wakisema kwamba msaada kutoka mashirika ya kimataifa umepungua kwa kiasi kikubwa. Wadau wa muungano huo wamesema kwamba upungufu wa fedha unahatarisha ustawi wa hospitali hizo na kuweza kuibua wasiwasi kuhusu makubaliano ya ushirikiano kati ya Kenya na Marekani. Wamesisitiza haja ya kutafuta suluhu la kudumu ili kuhakikisha kwamba huduma za afya zinaendelea kuwafikia wananchi. Muungano huo umeonya kuwa bila ufadhili wa kutosha, hospitali za kidini zitakumbwa na changamoto kubwa katika utoaji wa huduma.
They demonstrate high technical preparedness, of course, because we are endowed with digital knowledge, data-driven monitoring, capacity building programs, and so we are able and efficient in our services. But we cannot do this, the advocacy work, and we cannot make deeper impact without collaboration. So we have come in our meeting here as a family. We have come as a growing coalition of FBOs with collective policy understanding and changes, and we've come to stand together because, of course, we know that funding has been decreasing, but nonetheless we've come as one voice, unified voice, so that we can be able to move forward. And I would finally want to finish with a call for action that our partners, including the government, we request you to deepen your investment in the faith-based organizations, because we have been there, what we call in clergy language, the ministry of presence. We have been there when things are working, and we have been there when things are not working. And so we want to bring solutions to those people who are vulnerable, but we cannot do this without partnership. And we are here as a consortium. We can give our contact so that in future we can walk and work together. And on behalf of this group, we would want to thank for the state, because you've been walking and working with us, and so please accept our gratitude. Thank you.
Good afternoon, everyone. Yeah, my name is Dr. Chris Barasa. I'm the General Secretary and Chief Executive Officer of the Christian Health Association of Kenya. Today we happen to be the conveners of this meeting, and it's a rebirth of how the engagement in the health sector is concerned. And as we mark 40 years of such an ecumenical partnership that led to the creation of MEDS in 1986, I'm reminded that health systems are ever evolving. And the biggest challenge that we face today, as we faced in 1986, is actually healthcare financing. So the consortium aims at actually exploring both domestic and global health financing models that can sustain our own existence as faith-based facilities. And when I talk about faith-based facilities, I mean a whole continuum of care, from the community to the health facilities, to schools, and even to churches, because Kenya as a country, 95% of us profess to a particular faith. So what that basically means is that we have a platform that if we engage meaningfully, we can be able to achieve tremendous results as we work towards achieving universal health coverage. What have we covered today? A few strengths that have come out from this engagement today. We've actually realized that we have quite a lot of inherent capabilities. And I'll give you an example of MEDS that has been able to deliver last mile delivery of commodities in this country. And that's one of our partners. I'll also give you an example of the Diocese of Lodwar, the Catholic Church in Turkana, that has worked with the county government of Turkana for the last many years. And the last time I was in Turkana, the Diocese of Lodwar was contributing to just about 50% of services in Turkana. There's a model that we are borrowing from because the county government of Turkana gives some funding to the Diocese of Lodwar. It's a model that we wish to replicate at a national level so that the national government, the treasury, can also have a funding mechanism to work with the Kenya Expanded Health Services Consortium. As I come to a close, I want to acknowledge the fact that it's a journey that we are starting. It's a journey of partnership. It's a journey of collaboration. But we are committing to be present and available as and whenever we are called upon. And we are ready to collaborate with the county governments. We are also ready to collaborate with national government. We are also ready to collaborate with global governments, with global entities, to be able to ensure that Kenya achieves universal health coverage. That's the dream that we have for all of us, that we actually work together as a team in a concerted effort to be able to achieve universal health coverage. May I thank the Fourth Estate for being present here today. And we are looking forward to more collaborations because through you, we reach the population.
Na tukiachana na taarifa hiyo, taarifa ambayo tunazidi kufuatilia